The mpox virus triggers the World Health Organization's highest state of alert. Democratic Republic of Congo has reported the majority of cases, but infections have been recorded in Sweden and Pakistan. So, who's at risk? And is the world prepared for another global health emergency? This is Inside Story. Welcome to the programme. I'm Sahil Rahman. The World Health Organization has issued its highest state of alert after a surge in mpox virus infections in the Democratic Republic of Congo. Cases have now emerged far beyond the country's borders, showing how contagious the disease is and the international risks that it poses. Within the DRC, more than 7 million people have been displaced by decades of conflict, many forced to live in crowded conditions where the disease can run rampant. But in a nation of 100 million people and fighting in the east, vaccination is a huge challenge. And there's a shortage of vaccines, with only a small number approved for use globally. So can the DRC get the help it needs? Is the world prepared for this outbreak? And can the spread be stopped? We'll be putting that to our guests shortly. But first, Kulsum Sharif has this report.
A city at the heart of an armed conflict in Eastern Democratic Republic of Congo for decades is now on the front lines of another battle. Goma is ground zero in the latest outbreak of mpox. The rapidly spreading infectious disease is sending patients to this makeshift hospital in North Kivu province.
At first, I felt a headache, fever, muscle pain and pain in my groin. After spots started to appear on me, I thought it must be an infection. My body has completely changed.
The nation has reported around 16,000 cases this year and most of the deaths. It led the World Health Organization to trigger its highest international alert as a global health emergency on Wednesday. The virus spreads through close physical contact with someone who's infectious, contaminated materials, or infected animals.
I am worried. We have been shown images on the phone and on TV of people who are suffering from the same illness. I'm scared and I am so worried.
Mpox, formerly known as monkeypox, was first detected in research monkeys in Denmark in the 1950s and in humans in Congo in 1970. But the recent strain appears to spread more easily. The WHO says infants and children are more at risk.
75% of cases are in children under 10. Only 25% are in adults between 15 and 50 years old. It should also be noted that around 70% of these cases that come here are cases from camps for internally displaced people. So there is a high vulnerability within the camps.
The African Centers for Disease and Control and Prevention says mpox has been detected in 13 countries this year with more than 500 deaths. Other countries are now seeing cases, including Sweden, reporting its first case this week. Health authorities in Pakistan have also detected one case in a passenger returning from the UAE. In 2022, the mpox outbreak was reported in more than 70 countries. But its spread was slowed within months with vaccination programs and drugs in rich countries. Experts say there's an urgent need for vaccine supplies in African nations to stop the spread of the virus.
I would not recommend a general vaccination campaign for the general population or at-risk populations at this stage. It is also clear that the vaccines that are available globally are urgently needed in Africa, are urgently needed in regions where the virus currently is spreading, and there is a severe shortage of vaccines.
The goal of treating mpox is to take care of the rash, manage pain, and prevent complications. Getting an mpox vaccine will prevent infection and help curb the outbreak. Global pharmaceuticals are promising millions of doses in the coming months. Kulsum Sharif, Al Jazeera, for Inside Story.
So let's bring in our guest for this edition of Inside Story. In Geneva, Margaret Harris, spokesperson for the World Health Organization. In Goma, David Monkley, director of the aid agency World Vision's operations in Eastern DRC. And also in Geneva, Mukesh Kapila, Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester. He too was formerly Director for Emergencies at the WHO. A warm welcome to all our guests. Dr. Harris, can I just begin with you in Geneva? How worried should we be about this outbreak? It's focused in Africa, but as we see now, it is spreading beyond the continent.
Certainly, we don't call a public health emergency of international concern unless there is a reason for worry. I mean, the hint is in the name, international concern. And what we're worried about is the detection and rapid spread of this new strain, Clade 1b in Eastern DRC. It's the fact that it's spread so rapidly. It's also been detected in neighbouring countries that had not previously reported any types of mpox. And there clearly is potential for further spread within Africa, but also beyond into the rest of the world. And there is a need to try to stop it.
Indeed, we'll speak more about the actual biology of Clade 1 and Clade 2 a little bit later in the programme. David Monkley, just to get your general impressions, you're, as we say, at the coalface dealing with your staff and with your colleagues, not just in your agency, I'm sure you're coordinating with many other agencies as well, about the problem of mpox right now. Just give us an overview of where the focal point is for your aid operation.
Yeah, this is a crisis on top of a crisis, simply due to the fact that in Eastern DRC, there is a conflict that's been long-standing that has taken 2.5 million displaced people into camps in and around Goma in horrid conditions. So much of the work that we were doing was on really just basic food provision, some general cash support, protection services, really the basics. For this to come into these camps at this point is really horrific. It's a new crisis. And these camps, again, you have high numbers of malnourishment from children. You have high cases of abuse. These are really perfect conditions for the mpox epidemic to grow quickly. So it's a chief concern for us to do what we can now to really limit this as much as possible.
Dr. Mukesh Kapila in Geneva, you're no stranger to these sorts of emergencies and certainly this type of problem that the DRC is facing right now. In terms of the here and now and the long-term prognosis, let's just talk about the here and now and what you would expect to hear from the authorities in the DRC in how they are trying to help their health services and their health personnel on the ground with what's going on right now with mpox.
I think national health authorities in DRC and surrounding countries need to upgrade their own preparations. That means making sure that healthcare practitioners are familiarized with the symptoms and signs, ensure that they have systems in place for surveillance and testing, and to put into place preventive and public health measures, which include, for example, hygiene, sanitation, water, and infection control, which I think has an advantage. Not only would it help against mpox, but also against many other endemic communicable diseases, including recent epidemics, which are still grumbling away in these parts of the world. So that's the number one step to be taken, and to prepare the public as well to be recognize the disease when it happens in their families and communities and bring it to the attention of the healthcare providers so that the outbreak as it evolves can be properly tracked.
Yeah, we'll talk about how they actually get that word out as well a little bit later in the programme. Margaret Harris in Geneva, I mean, how problematic is it to be able to deal with this when there's also conflict in the area? Obviously, you're dealing directly with your medical colleagues and equivalents in the DRC, in government. But at the end of the day, the trauma is hundreds of miles away from the capital of Kinshasa.
Indeed. Conflict makes everything more difficult when you're dealing with public health. That the advice indeed is to say, come to the health centre, get treatment, protect yourself. Now, if you're a displaced person, you're in the middle of a conflict, you can't get to the health centre, you can't protect yourself. And as David mentioned, you don't have food, you don't have water, you don't have the safe conditions. So at the same time as we take all the actions, which we are taking, to prevent the spread, there needs to be much more effort to resolve the conflict and support the population. Otherwise, you will just continue to have problem on problem, as David said, crisis on a crisis.
David, can I come back to you, Ngoma? Can you just tell us a little bit about those living conditions and the situations that have been displaced, not just once, but maybe twice or thrice, are actually facing? Because this all adds to the trauma of not being able to have clean health facilities, clean water, clean food, and accessibility to medical care.
Yeah, these camps, they really sprung up overnight. They were unplanned. So people would literally find themselves on the side of a road at different points in or on the periphery of Goma. And poof, all of a sudden it would be 10,000, 15,000. The other day was at a camp for 22,000 households, over 100,000 people. There was garbage everywhere. There's no strong sanitation system. We in World Vision, we provide, again, emergency food and cash and some hygiene support, but we're overstretched. This is so big. There's hundreds of thousands of displaced people just around Goma. So for this to make itself known, for mpox to enter into these camps, we're overstretched as it is. We're underfunded as it is. So to be able to find the resources necessary is incredibly difficult, which is why we're asking the international community to step in immediately, because we need more support in these camps.
David, I'm just going to halt our little conversation here for a moment to give our viewers a little bit of context, and then I'll be coming to Mukesh shortly, because the Democratic Republic of Congo has been at the centre of the recent outbreak. As we've just mentioned, it accounts for more than 90% of the reported infections. Burundi, Kenya, Rwanda and Uganda have reported their first mpox infections in the past month. Now, those cases have also been identified in Nigeria, Cameroon, Central African Republic, South Africa, Ivory Coast, Liberia and Ghana. It's also sparked concerns about spreading to other countries around the world. And as we just mentioned, Sweden has recorded its first case, and Pakistan too has increased screening of passengers at its airports after a traveller tested positive for mpox. So we've given our viewers at home, Dr. Mukesh, an idea of how far and wide this is going. Porous borders across the conflict zone of Uganda, DRC, Burundi doesn't really help matters. And now we're seeing Sweden and Pakistan in that whole mix. When you investigate and you backtrack to where this all occurred and how this is transmitting, besides isolating an individual and interviewing them, what is the process to try and contain the problem? Certainly for countries like Sweden and Pakistan right now, two diverse countries.
I think it shouldn't be a surprise to anyone that disease is spread. And first to say, it is very, very important not to have dysfunctional measures like border closures and the panic that has often attended the past outbreaks. You only have to look at Ebola and COVID, which those things cause as much problem as the original disease. Now, what can be done about it? I think if an outbreak is detected in a location, wherever that might be, whether it's Sweden or Pakistan or in some African country, it is about isolating the person. It is about isolating their contacts. It's about, if you have access to vaccines, but vaccinating those contacts and then keeping an eye on the immediate neighborhood so that local outbreaks can be controlled. This is where vaccination does come in, and why the availability of vaccines, not for general deployment, but for outbreak control, is extremely important, because the vaccines are quite effective. Having said all of that, none of this is possible, as Margaret has already said, if in the middle of a crisis you don't have access. And as we already heard from Goma, if resources are limited and infrastructure is very poor. So, there are no shortcuts to this. But all these complicated circumstances should not at the same time be called that it's all hopeless, we can't do anything. A lot can be done locally, little by little, in a myriad different situations. And this is where national action and national authorities in the lead and local organizations, local communities are totally vital to control these outbreaks.
Yeah, I know David's agreeing. I'll come to you in a moment, David, about the agreeing about community support. Dr. Harris in Geneva. Can we just talk for the viewers as well? What vaccines are available and are, you might say, eligible to get into the DRC? And what is being, you might say, researched or not quite verified yet, given the WHO tick of approval before they can be distributed? How quickly can we get these vaccines there? And can we get them in the volumes that Central Africa needs?
So there are two main vaccines. These vaccines were actually developed against smallpox, and mpox is a member of the same family, and they've been proven efficacious against mpox. So that's why we have these vaccines, and that's why they've been in some countries, because they've actually built up smallpox stockpiles. For one of them, they've both got terrible names, I'm sorry. One is called MVA, and there are currently 0.5 million doses available in stock. And the manufacturer says that they could produce an additional 2.5 million doses potentially. So by 2025, we hope there will be an additional 10 million doses produced. The other one is LC16. It's a vaccine that's not commercialized, but produced on behalf of the government of Japan. And there's a considerable stockpile of this vaccine. And Japan is working closely with WHO on facilitating donations of that vaccine. So there are vaccines. Now, the question is, and the important thing to understand is, just as Mukesh mentioned, I think, is they're not for mass vaccination campaigns. They need to be used in a very targeted way. And they're best if they're used for prevention of people at very high prevention of infection, people at very high risk, or those who've just been in contact with a known case, if you can vaccinate them very early. So again, as we said, this depends on getting the vaccines to the right people, knowing exactly where the virus is, being able to track it, and doing the best quality public health.
So let's go back to David there in Goma. You were nodding in agreement about the communication, David, because even with COVID, people in Africa, because of bad faith, because of being suspicious, cultural differences, were always very worried about vaccines and not always happy that these were in the system. And as Mukesh mentioned, getting the word out is very important. How are people reacting to the potential possibility of taking a vaccine? You know, they can be suspicious, they can be worried, be it myth, gossip or superstition. What's the general consensus from what you're hearing?
There have been some gains made due to the fact that in recent times there's been COVID, but locally as well, there was also the Ebola epidemic. So there's a better understanding of vaccines. But when we talk about that local communication component, that's very important. We talk this is an international concern, but so many of the solutions will happen nationally or locally. Hygiene promotion, for example, early detection and surveillance. This is where we need more support. Because if you're able to, detect early these cases or identify certain weak spots, do stronger hygiene promotion, set up necessary sanitation services, you're going to address so many of the many issues that could lead to greater mpox numbers in these camps. So it's, again, working in partnership with these communities to really focus on those most vulnerable. As we've noted here, in many cases, it's children who are bearing the brunt of mpox cases and even fatalities, So for us, it's really about continuing kind of hygiene promotion, community dialogue and discussion to ensure that there's buy-in, there's support at local level, because that's where so much of this is going to take place.
Dr. Mukesh Kapila in Geneva, it's all very well, isn't it, to try and get the communication sorted. But again, to get the vaccines there requires money, it requires a budget, it requires goodwill. There is an organisation, part of which the WHO is a member, called Gavi. For our viewers, it's about the rich north, isn't it, or the richer developed countries helping the poorer south or the poorer countries in the world when it comes to the need for vaccines. We saw this during the COVID pandemic. It's a system that works if it works properly.
Yes, before I come to that, let me just make a point to the communication point. I'm a veteran of the HIV origins from all those early decades ago. And I remember the earliest struggles against HIV. And the biggest issue apart from trying to get the word out, was the issue of stigma. And stigma undermined control efforts for a very, very long time in HIV. And elements of that we also saw in the Ebola epidemic in West Africa. So my point here is that I hope that David's strategy in Goma and others has a strong focus on ensuring that the victims are not being stigmatized because, of course, one of the roots of transmission is also sexual. That's one thing. And secondly, there's so much misunderstanding that are always there at the beginnings of any condition that specific communications are needed to overcome, to dispel misunderstandings. And here I'm not even talking about all the vaccine deniers and so on. That's a separate issue. Coming to your question of vaccine equity, this, of course, is an ongoing debate. Now, we have the international health regulations, and thank goodness at the last World Assembly, the world agreed to improve it and revise it. We're still in the middle of the pandemic negotiations in terms of a better treaty. And where we're stuck on is this business of fair sharing of resources and opportunities around the world to control diseases, to which all countries are there. Now, I think we have to be realistic. So what's happening now is that countries like Switzerland, where I am, and Canada, the US, in the European Union, I hear they're busy stockpiling vaccines. They've already got some stockpiles for their populations of concern. And, you can't blame these governments to try and preserve the health of their own at-risk populations. That I would expect my government to do also. So what we need is, but they shouldn't stockpile to the point that they design others life-saving vaccines. And this is where we do need WHO and Gavi and others and the UN generally to come in and say, hey, guys, can we have some kind of rule whereby we're not saying you give us your vaccines that you need for your own populations, but at least let's have a formula which makes available these vaccines for other countries, especially now. This outbreak is going to be controlled in Africa, not anywhere else. And so that's where we need to focus on to get vaccines there.
And Dr. Margaret Harris, can I just then bring in, a sort of a dogleg of a question here, because we've seen that the DRC is going through a major crisis on its eastern borders with civil strife and rebel groups all vying for territory, and there is fighting. We know how that's impacting on the public at large. But we also have conflicts in Ethiopia and Sudan, and we're seeing that this virus can transmit itself very quickly. If it can get to Sweden and Pakistan and get to other parts of the continent. I know Dr. Mukesh is also nodding in agreement. How do you actually start talking to governments and to interested stakeholders when there is conflict in the region?
Well, this is really the biggest difficulty I think we as the world face right now. I mean, we're looking at conflict around the world that is causing massive threats to human health, because the health systems that have taken decades to build up are just being destroyed. And indeed, as you say, if a virus gets into a country that's got no surveillance and has got no health system, first of all, you don't know it's there because you haven't got the surveillance. Second of all, if you even suspect it's there, you can't offer the treatment because people can't even leave their homes and come to a healthcare centre with any safety. And with the conflicts going on around the world, we are asking for trouble. We can be brilliant at public health. We can be brilliant at developing vaccines. And yet all of that is destroyed by conflict.
And I've got Dr. Mukesh, can I just come to you? I mean, it might be destroyed by conflict, but is there now a time or a discussion, and again, going to another direction, where you might say a global health card is required by people who travel that would be universally accepted by all governments? I know that the issue with an identity card is always problematic in lots of countries, but to give the basic information of what vaccines you've had and what blood type you are, is that a conversation that can ever be had with senior civil servants? Forget the power brokers. It's always the civil servants that develop and push policy.
I think this is extremely important. I remember being in Lebanon and seeing the Syrian refugees coming across. And so many of them were the children, Syrian refugees, they were hyper-vaccinated. They were getting their polio vaccines and the other measles vaccines over and over again. because they didn't have proper records, and doctors are trained not to believe anyone else, and they do things in a precautionary manner. Now, I think, and we have migratory populations even more in the north. How many? 12 million are displaced in Sudan, many of them as refugees. So we know that there are schemes going on in terms of digitally held records, which can be kept safely for populations in crisis. And it doesn't have to be populations crisis. So some kind of system under the framework of universal health coverage, which WHO is such a big champion of, so as to ensure that health records follow the people wherever they might be taken by a conflict, and they're accessible to decide the optimal care for them, whatever little access and care might be available to them. And yes, this is also a very important tool to give agency to individuals caught up in conflicts and crises and are moving around. And of course, climate change is going to only make that worse. So I think this is a very good idea. And we need a global approach to this, building on the tools that WHO and UNHCR and others have already got and are working with.
Margaret, just that final word, marshalling your resources to help those on the ground. That's the message. Can the WHO with its partners globally help Central Africa in this particular instance?
Absolutely. And that's probably the main reason for calling the public health emergency of international concern. When you have an outbreak like this, the world needs to come together, bring the resources, be they human, financial, scientific, technical, like vaccines, bring it to where the problem is. Don't be worrying about it coming. Stop it where it is. And just as a matter of the world community, we've mentioned the pandemic treaty. This is what it's about. We can stop these problems if we work together, even when we have conflict. And we, all of us here, all the health workers, we'll never stop trying to help.
Well, that's great to hear. And it's good to have all of you here on Inside Story. Dr. Margaret Harris, David Monkley and Dr. Mukesh Kapila, thank you for joining us both from Geneva and from Goma. And thank you too for watching this edition of Inside Story. You can watch it anytime by visiting our website at aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on X. Our handle there is at AJ Inside Story. From me, Sahil Rahman, and the Inside Story team here, thanks very much for your time and your company.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.